Your parent just called you for the third time today asking the same question. You laugh it off as a senior moment. But what if I told you this could be a critical warning sign you're missing? What if ignoring these signals could put your parents in serious danger? Most adult children miss the early warning signs until it's too late. Until Teresa fall. Until Teresa hospital visit. Until something happens that could have been prevented. I'm going to share 10 warning signs that your elderly parents need more help at home, and some of these might shock you. Here's the thing nobody tells you about aging parents. The decline doesn't happen overnight. It's gradual. It's subtle. And that's exactly why it's so dangerous. You visit once a week, maybe twice, and everything seems fine. But between those visits, There's a whole story unfolding that you're not seeing. Let's start with the first warning sign, and this one catches most people off guard. Changes in personal hygiene and appearance. Now, I'm not talking about your dad wearing the same shirt 2 days in a row. I'm talking about noticeable neglect. Your mother who always had perfect hair now has it unwashed for days. Your father who was always clean-shaven now has a scraggly beard. These aren't just cosmetic issues. When elderly people stop maintaining their personal hygiene, it usually means one of three things is happening. Either they're physically unable to perform these tasks anymore, they're cognitively forgetting to do them, or they're experiencing depression. All three scenarios require immediate attention. The physical inability might mean they can't safely get in and out of the shower. The cognitive decline could indicate early dementia. The depression is a serious mental health concern that needs professional intervention. Pay attention to their clothing too. Are they wearing the same outfit multiple days in a row? Are their clothes stained or dirty? Can they still manage buttons and zippers? These details tell you whether they can still perform the basic activities of daily living independently. If you notice these changes, it's time to have a conversation about getting help with bathing, dressing, and grooming. The second warning sign is changes in the home environment. Walk into your parents' house and really look around. Not with the eyes of a child visiting home, but with the eyes of a safety inspector. Is the house messier than usual? Are there piles of mail unopened? Dishes stacked in the sink? Trash not taken out? A cluttered or dirty home isn't just about housekeeping standards slipping. It's a red flag for several serious issues. Your parents might be experiencing mobility problems that make it hard to clean. They could be dealing with cognitive decline that affects their ability to organize and maintain their space. Or they might be so overwhelmed or depressed that they simply can't manage anymore. Look for more specific danger signs too. Are there burn marks on the stove or countertops? This suggests cooking accidents. Are there water stains on the ceiling or walls? This could mean plumbing issues they can't handle. Is the yard overgrown when your dad always took pride in his lawn? These environmental changes are your parents' living space telling you they need help. Here's warning sign number 3, and this one is critical. Unexplained bruises, burns, or injuries. I know what you're thinking. Elderly people bruise easily. That's true. But unexplained injuries are different. If your parent can't remember how they got that bruise on their arm, or if they seem confused about a burn on their hand, you need to investigate. These injuries often indicate falls that they're not telling you about. Falls are the leading cause of injury and death among older adults. Your parents might be falling regularly but hiding it from you because they're afraid. Afraid you'll put them in a nursing home. Afraid of losing their independence. Afraid of being a burden. So they minimize it or don't mention it at all. Burns, especially on the hands or arms, often come from cooking accidents. Forgetting the stove is on. Reaching across a hot burner. These aren't just accidents. They're signs that your parent might not be safe cooking alone anymore. Document any injuries you see. Ask gentle questions about how they happened. And if you're seeing multiple unexplained injuries, it's time to increase supervision and support. Warning sign number 4 is medication mismanagement. Go to your parents' medicine cabinet right now if you can. What do you see? Expired medications? Bottles with pills that should have run out weeks ago? Multiple bottles of the same medication? This is more common and more dangerous than most people realize. Medication errors among the elderly can be fatal. Taking too much of a medication. Taking too little. Missing doses entirely. Taking medications that interact badly with each other. These mistakes happen when cognitive function declines or when the medication regimen becomes too complex to manage alone. If your parent is on 5 or more medications, the risk of dangerous errors increases dramatically. Look for other signs too. Are they refilling prescriptions on time? Can they explain what each medication is for? Do they know when and how to take each one? If you're seeing confusion or mistakes here, they need help managing their medications. This might mean a pill organizer, medication reminders, or having someone oversee their medication routine entirely. The 5th warning sign is social withdrawal and isolation. Your mom used to go to book club every week. Now she makes excuses not to go. Your dad was always at the senior center playing cards. Now he stays home. When elderly people start withdrawing from activities they once enjoyed, alarm bells should ring. Social isolation in the elderly isn't just about loneliness. It's linked to serious health consequences. Higher rates of depression and anxiety. Increased risk of dementia. Higher blood pressure and heart disease. Even increased mortality rates. When your parents stop engaging with their community, their physical and mental health suffers. But why do they withdraw? Sometimes it's because they're embarrassed about their declining abilities. They don't want friends to see them struggle. Sometimes it's because they lack the physical stamina to participate. Sometimes it's depression making them lose interest in everything. And sometimes it's because they can no longer drive safely and have no way to get to their activities. Each of these reasons points to a need for more support at home. Warning sign number 6 is dramatic weight loss or gain. Has your parents' clothing started hanging off them? Or are they suddenly much heavier than before? Significant weight changes in the elderly are never just about diet and exercise. They're warning signs of serious underlying problems. Weight loss often indicates they're not eating properly. Maybe they're forgetting to eat. Maybe they can't cook anymore. Maybe they're having trouble chewing or swallowing. Maybe they've lost their sense of taste and smell, which is common in aging. Or maybe they're experiencing depression, which kills appetite. Unintentional weight loss in the elderly increases their risk of falls, infections, and death. Weight gain might seem less concerning, but it's equally problematic. It could mean they're eating poorly, relying on convenience foods because they can't cook. It could indicate reduced mobility and activity. It might signal medication side effects or underlying health conditions. Either way, significant weight changes mean you need to assess their nutrition and eating habits immediately. Here's warning sign number 7, and this is the one most people miss until it's too late. Cognitive decline and memory problems. Yes, some memory lapses are normal with aging. Forgetting where you put your keys happens to everyone. But there's a difference between normal aging and cognitive decline that requires intervention. Repeatedly asking the same questions within minutes. Forgetting appointments or important dates. Getting confused about time or place. Having trouble following conversations or finding the right words. These aren't just senior moments. These are signs of possible dementia or other cognitive impairments that need medical evaluation. Watch for changes in judgment too. Is your parent falling for scams? Making poor financial decisions? Forgetting to pay bills? These cognitive changes can have serious consequences. Financial exploitation of the elderly is a massive problem, and those with cognitive decline are the most vulnerable. If you're seeing these signs, your parent needs both medical evaluation and increased supervision to protect them. Warning sign number 8 is mobility and balance issues. Your parent used to walk confidently. Now they're shuffling. They're holding onto furniture as they move through the house. They're hesitant on stairs. These changes in mobility and balance are major predictors of falls, and falls in the elderly can be catastrophic. A fall for an elderly person isn't like a fall for a younger person. It can mean broken hips, head injuries, or long hospital stays that lead to further decline. Even if they don't get seriously injured, the fear of falling can make them even less mobile, creating a dangerous cycle of declining strength and increasing fall risk. Look at their environment too. Are there throw rugs they could trip on? Poor lighting in hallways? Clutter on the floor? These hazards combined with declining mobility create a perfect storm for accidents. If your parent is showing mobility issues, they need both environmental modifications and possibly physical therapy or mobility aids. They definitely need someone checking on them regularly. The 9th warning sign is difficulty with instrumental activities of daily living. These are the complex tasks that allow someone to live independently. Managing finances. Shopping for groceries. Preparing meals. Using the telephone. Taking medications correctly. Doing housework and laundry. Using transportation. When your parents start struggling with these tasks, it's a clear sign they need more support. Maybe your mom's checkbook doesn't balance anymore. Maybe your dad can't figure out how to use his new phone. Maybe the refrigerator is empty or full of expired food. These aren't just inconveniences. They're indicators that independent living is becoming unsafe. The tricky part is that elderly people often hide these struggles. They're proud. They're scared. They don't want to admit they need help. So they might tell you everything's fine while their bills go unpaid and their cupboards sit empty. You have to look beyond what they tell you and observe what's actually happening in their daily life. The 10th and final warning sign is changes in mood and personality. Your gentle mother is suddenly angry and aggressive. Your calm father is anxious and agitated. These personality changes aren't just about getting cranky with age. They're often symptoms of underlying medical or psychological problems that need attention. Depression in the elderly looks different than in younger people. Instead of sadness, you might see irritability, anger, or apathy. Anxiety might manifest as excessive worry about health or safety. Agitation could indicate pain, infection, or medication side effects. Even early dementia can cause personality changes before memory problems become obvious. Pay attention to emotional changes too. Is your parent crying more easily? Seeming fearful or paranoid? Losing interest in things that used to bring joy? These emotional shifts tell you something is wrong, whether it's a medical issue, a mental health problem, or a reaction to their declining independence. They need professional evaluation and support. Now here's what you need to do with this information. Don't panic, but don't ignore these signs either. If you're seeing one or two of these warning signs, it's time to increase your involvement and monitoring. If you're seeing 3 or more, your parent needs immediate assessment and intervention. Start by having an honest conversation with your parent. Use specific examples of what you've noticed. Express your concern from a place of love, not criticism. Listen to their perspective and fears. Then work together to develop a plan. This might mean hiring a home health aide, setting up meal delivery, arranging transportation, installing safety equipment, or bringing in professional caregivers. Remember, Getting help early is always better than waiting until a crisis forces your hand. Your parents deserve to age with dignity and safety. And you deserve peace of mind knowing they're getting the support they need. Don't wait until it's too late to act on these warning signs.